One word: persist. Persist. Continue to learn. Continue to listen. Understand that when we engage with people inside of our system or in the community, that there are structures that have been there for decades or centuries, so that everyone we engage with in equity work are bringing their social, their economic, their political, their trauma with them. And we have to humbly understand that. So the concepts of structural competency, structural humility says to us, people bring their historical trauma with them. And in this role, we have to understand that and not make any assumptions about any of it. So that rests on some tenets from Kamara Jones, a friend of mine. In this role in health equity, you cannot be ahistorical about equity. Go and find out the history of inequity. Find out about the history of inequity in your system. Look at how people in your system have been dehumanized and devalued. And then how can we transform that? And then lastly, how do we allocate resources? How do we allocate resources to where those resources are most wanted? Most needed, not where they're most wanted. And all too often you hear people that here's what we want because of who we are or the area in town that we live in. But the data says that the resources are most needed here. So now you have to be able to make that case. We need to redirect resources, and that's a scary conversation, but it's an equity conversation, not where people are saying we want this, but where the data says it's needed.